The reason we wrap a room is to protect the employees, but also to protect the next patient coming into the room. Everything's wrapped in plastic that the patient might touch. That is so that way they don't leave radioactive fingerprints or anything, oils on the bed rails, the handles, anything that they might touch. So it can be removed easier by housekeeping when they come in to clean it. They just take off all the plastic, throw away the plastic, and anything that's left in the room. The kind of treatment these particular patients receive is for thyroid cancer. It's very, very specific. What we do is give them a radioactive pill. Looks like a Tylenol, very, very small. You can't smell the radioactivity. You can't see the radioactivity. It looks just like a Tylenol. All they do is swallow it, and it kind of spreads out through their body and attaches to the thyroid and then kills the thyroid cancer in their thyroid. Normally, the effects last about 3 days. After 3 days, they can be released and go back home. There are some additional restrictions when they get home, but for the hospital stay, it's normally about 3 days. We know a room's ready to be cleaned when we measure the patient. They have to be below what we call a releasable level. Once they reach that amount, again in about 3 days, that means they can go home. So we bring them to the scan. While they're doing that, the nurses are preparing discharge orders. When the patient returns back to the room, the patient is released. Now that means the patient might be gone, but the material in the room, the linen, the trash, the food items, those might still be a little radioactive. So we normally wait about 3 days before we go back in to measure them with a Geiger counter. Once we do go in with a Geiger counter, we can measure the trash. If it's radioactive, the little machine will beep. We wrap it up, separate it from everything else. We do the same thing with the linen. If it's radioactive, it will beep very loudly. It's very, very, very distinct. We separate it from everything else, and then we take all the radioactive material with us to storage. Whenever you see the yellow sign, it's very important that you do not enter the room. The yellow sign means it's radioactive inside. Do not enter. If for any reason someone requests for you to go in or insists that you go in, and you see that sign on the door, do not enter. My phone number is on that sign. Call me immediately and say, hey, someone's trying to make me go in. What should I do? And I'll help you out. I'll talk to them. I'll explain to them what's happened. But the big yellow sign, the reason it's yellow is to kind of alert, give you a visual alert to make sure that you do not enter the room. Very, very important. Do not enter the room when you see that yellow sign on the door.
Now, we will review the room wrapping process. During this process, hand touch areas will be wrapped, such as light switches, doorknobs, dispensers, chairs, seats, and other surfaces that are touched by the patient. For the wrapping, we will need the following: a set of large and small liners, a pair of scissors, and 2 sets of tape cloth. Next, let's review the faucet wrapping process, and it's very simple. First, you want to wrap around the faucet until you get to the bottom. Then expand the back and wrap the faucet handles. If possible, create a knot around the handles and secure with tape. For dispensers, such as the soap dispenser and the paper towel dispenser, it's best to open them and place the back on, as shown in the video. And use some tape to secure the back. For handrails, place the liner around the handrail and secure it with knots. Also use some tape to secure this. And repeat the same process until you finish the whole handrail, as shown in the video. wrapping a doorknob, use the same process. Use a liner to wrap a bag around the doorknob and secure it with tape. For bed footboards, what we'll do is place a bag on top of the footboard to cover it. Make sure that the bag is secure and then use some tape. And as we see, room wrapping is a very easy process. We just need to wrap the areas that a patient might touch. One thing to keep in mind is that electrical outlets, door hinges, and other kinds of metal items do not have to be wrapped. Thank you for watching.